how you got started with Egoscue, kind of, what passion or interest led you down this road, and how you got to this part of your journey in terms of helping others. So Emily, maybe we can start with you.
Sure. So I started out as a dancer and a technique coach, and then moved into personal training. And this was about 12 years ago. And I found that I wasn't entirely fulfilled with the personal training aspect of things. I didn't have as much of a knowledge base to help people the way I wanted to, and I wasn't quite sure what was missing at the time. I was fortunate enough to move into being a physical therapist aide, which was we were moving the needle a little bit more, and I was helping patients with doing exercises to help them with any sort of rehab. The tricky thing about that was we kind of kept hitting this wall where insurance was predetermining, okay, after this many PT sessions, your knee should be good to go, or your shoulder should feel better. And I was hoping that at the end of these sessions, whoever I was working with after a course of weeks would be like, yeah, I feel so much better. I feel good as new. And I wasn't hearing that. And that left me feeling a little lackluster. But one of my personal training clients was going to Egoscue at Santa Monica at the time, and I had never even heard of Egoscue before. So I was a little resistant because I thought maybe it was some kind of gimmick that worked for him, but I wasn't too interested. And then he kind of kept pressing the issue, like, you should really check out Egoscue. You'd be so into it. He was kind of explaining it has so much to do with your posture and your alignment, and you really care about form, and with dance, I think you'd really appreciate it. So several months later, I finally acquiesced and joined him for a session at Santa Monica. And that opened a big door in terms of things making sense, why some symptoms persist. And it kind of answered a lot of these questions of, oh, Egoscue helps you get to the root of the problem. It doesn't just address the symptom. It doesn't just address this perpetually tight hip that you have to stretch every day. It gives you the reason. Fortunately, they were hiring when I came to the clinic that day. I found that out. And here we are 8 years later.
Yeah, so cool. So it was a big paradigm shift, how you saw things from the personal training and the PTA side to.
Yes.
Egoscue.
Yeah, it was awesome. It was a life-changing day.
Awesome. Matt, how about you?
Sure. So my background is in athletic training and sports medicine. So after I graduated college, I worked for a few of the Division I colleges in the area, UMass Amherst and Holy Cross in Worcester, Massachusetts, and saw a whole bunch of injuries, sprains, strains, broken bones, the things that happen acutely in athletic events. So what athletic trainer is the person who runs on the field when athletes get hurt and then runs them through rehab protocols to help them return to play. So got a great knowledge base in acute, injury treatment, and then I guess chronic, you could say too, injury treatment and the prevention side of things. And I got in it to help people. I love helping people. I love working with people and building those connections and those relationships. One of the interesting things, so I think there's two distinct things in like the career before Egoscue that led me here was athletes who would, let's say, pull a hamstring, for example, and then, we'd work directly on the hamstring, but then the back would develop pain. So they had pain in their back, and then maybe it would transfer down to the knee or the ankle. Kind of, in a lot of those instances, could go to other areas, and you're like, wait, what's happening here? Like, why are these other areas? Because you didn't have a direct injury mechanism, so why are these areas hurting? So kind of planted the seed that something's going on here, but I didn't know based on our training, like the connection between them all. Or if an athlete was injury prone, it's like, I keep injuring this hamstring, or I keep spraining this ankle. It's like, well, why is that happening? They're, 18, 20 something year old kids in the best shape of their life, and so why are you injury prone? And why is it this usually a recurring or same injury? So it started getting me thinking that there's probably something more to this, but I just don't know how to address that or what that is. And then after I worked for the colleges, I worked for a company that did orthopedic bracing. So knee braces were the most common thing for people who had, ligament sprains, strains, tears, repairs. And one of the braces that we would fit people with is called an offloading brace. So it's for arthritis and typically in the knee, where the brace has a little pad and that you crank on that, and then it pushes the knee into a a better alignment. So say somebody has a knee that's angling inward or knock-kneed, the brace would be fit on the knee, and then you crank the piece on the inside, which would help push the knee out of that knock-kneed position. Put the brace on people, cranked up with an Allen wrench, you cranked the little device, and people started walking around and said, oh, my knee feels so much better. Like if there was arthritis that they were looking to try to stave off a knee replacement for, and then they take the brace off and start walking around and be like, oh, nope, not as good. Put the brace on. Oh, it feels so much better. And I was like, that's interesting. So this thing changing the position of the knee, even though there's arthritis, and then it feels better for them walking. And I was like, so the alignment or position of the knee affects how they feel. And so then I'm like, all right, there's something to this. And I know the brace is it, obviously in the body, muscles move the bones, right? So if the brace is moving the bones of the knee into a better alignment, certainly muscles should be able to do that. And that really got the positioning or the alignment piece like in my head. So when I went to find another job, and I really enjoyed working with people in that clinical setting, found Egoscue online, read the philosophy. I'm like, well, that certainly aligns with what I'm thinking and what I'm seeing. And when I was invited in for an interview and then an observation, they was just blown away by the instant results people could get in pain symptom with arthritis, sciatica, scoliosis, hip pain, back pain, things like that in one session. And I was just blown away. And I said, yep, this is it. Like this is the missing link that I was trying to find between health and wellness and prevention too. So helping treat injuries and people move past the pain, but then preventing it in the future. So 6.5 years later, here we are.
Yeah, awesome. Yeah, that's crazy that they realize the alignment, but how you go about it.
Yeah, exactly. Yeah, the light bulb went on, but it wasn't, fully lit just yet. So like, oh.
Like on a dimmer.
Yeah, exactly. So one of those dimming lights, like 50% capacity. Yeah.
Cool.
Yeah.
Lisa, how about you?
Let's see. After college, I started working as a physical therapy aide, so a little similar to Emily. So that was the first kind of real interaction that you get with, patients either coming out of surgery or dealing with an injury. In terms of trying to get better and get back to their activity. And I was doing that for, a couple of years in a couple of different settings, mostly outpatient, some inpatient. But after a while, you kind of start noticing it's the same no matter what. So if you have a shoulder injury, depending on the shoulder injury, this is your protocol. If you have a back pain, this is your protocol. If you have knee pain, this is your protocol. For an ankle sprain, this is what we do. This is how you progress. And, in some cases, people are like, okay, yeah, that feels fine. And they go about their way. And then, you see them again the next year for the next injury or, resprain or another injury, maybe the other side. But then there's also, similar to Emily's experience, is also that kind of cluster of patients who never fully get back to doing what they're doing. And then, as good as physical therapy can be, at some point it's just like, okay, well, you just need to change your activity. So probably no more running, try the elliptical instead, try a stationary bike, try, just walking, which isn't always what somebody wants to hear, especially if they're being very active. So then, it could just be using braces or doing different things. But there was always sort of that stopping point of either they've kind of reached the end of the protocol or their insurance said, that's it, no more. And, if they wanted to continue because they felt like they were making progress, they had to go to the insurance company and see if they would approve more. Sometimes they did, sometimes they didn't, and then the only other option was, you'd pay for your therapy out of pocket, but most people didn't do that. So then simultaneously, I was also working as a trainer over at a gym as well, which is also very fun. You can get creative, but you can plan this really great workout, and then there's usually one or two people who come in and, oh, well, I have this shoulder thing or have this back thing. So you always had to have a modification. And then, you would talk to them and ask, what kind of things are you doing? Oh, well, I'm doing physical therapy. Here's what they told me to do. This is what I'm doing. And that was just sort of it. That was just sort of their routine. And it becomes this idea of, well, I just can no longer do that. And then the next idea is like, well, I'm just, I'm in my 50s. I'm, getting up there. And so I did that for, a few years. And then was looking for something a little bit more, just, kind of get a little redundant, and sometimes you just need a little bit of variety. And that's when I found Egoscue, and I didn't really know a whole lot about it. But then as you just kind of start reading, like, oh, it's corrective exercise. That's something I can do, no problem. And then you go in, for your first day, and you're observing a lot of the clients and seeing like what the exercises are, which for any of our clients that are watching, they're very strange. Usually that first time around, when you're like, what do you mean this is an exercise? Or why does this look so easy, but it's so challenging? I think one of the first things I ever did was a standing windmill, and I couldn't stand up against the wall. I went, why is this so hard? So then you kind of see, okay, there's a lot more to it than it's just a back issue. It's not just a back issue. It's tied into the bigger picture, which is, how the pelvis is connecting to your shoulders, how the shoulders are connected down to your feet. So really taking that whole body approach, I thought was very, very key. And then also the time that you get to spend with the clients, because we are considered holistic. You're not restricted by an insurance protocol saying you can only spend 30 minutes with this client or this patient, and then they're off to do their exercises with somebody else. You can actually have time to figure out, why is this not going the way that we expected it? Take a little bit of extra time where you just get to know the person. What are they wanting to do? What activities do they want to get back to? And you actually have the room to figure out, okay, how do we get you back to running? Troubleshoot along the way and actually get you back to where you want to be, rather than just say, well, you're 65, you should probably let it go. Most people don't like to hear that. So I think that that's a very key component of Egoscue, is the ability to say, well, let's figure it out. There's an underlying reason, and we have the means to understand it. So let's figure it out and then do what needs to be done to get you back to running or whatever activity you want to do.
Yeah, totally. And you being an athlete too.
Yes. And then you're like, I wish I knew about this when I was competing.
but to not be able to do something. Yeah, and not to be able to do something like stand up against the wall and do an exercise probably was like, okay, wait a minute.
Yeah,
I can
exactly.
run fast. I can pull vault. I can do all these things. What the heck's going on?
Yeah. It's funny you say it. You just, to add to that, when I came in the first day, the therapist who was working with my client at the time, he knew that I danced. And so he said, do you have a harder time balancing on your right leg? And granted, it could be a 50-50 guess because we only have two legs. But I was like, why would you ask me that? Also, he was right. And we just accept this. I have a good side, I have a bad side, or these are just things I can't do because everybody has a limit or, some sort of imbalance. Yeah. And it was just so interesting because like what you said, Lisa, like, man, if I had known about this before, like think of what more I could have done, or maybe like pushed myself to sort of achieve in terms of like balance versus heavily relying on strengthening my left side. Do you know what I'm saying? So that's just, it's interesting. It wasn't that I was dealing with pain. I was just accepting that I had to work around this side isn't as good. I can't rely on this side as much.
It's cool because that's a journey that a lot of our clients need to go on.
Exactly.
For us to experience that or to recognize that within our own self, and challenges the belief system and those limitations or those rationalizations or things we've been told or that we learned along the way.
Yeah.
And, it's like, okay, so I mean, this is changeable, which is, it's both a daunting thing and it's a like kick yourself because why didn't I know about this sooner, like Lisa said, but then it's also like, oh wow, like this is optimistic because I can change this.
Yeah.
So there's a whole sort of mindset that goes through it. I think I'm the only one here who graduated in the 90s from college, back in the 1900s. But I studied athletic training, played sports, played rugby. So all those cracks and sprains and strains that Matt was talking about, like I got to see all those firsthand and experience a good number of them as well. And then did some personal training on the side to, for income while I was in college and stuff. And then for my graduation present, my mom sent myself and my aunt and one of my sisters came with, we went to China. And of course I needed some reading for the long trip and, just graduating from college and taking kinesiology and biomechanics and, all this stuff. maybe I would do something entertaining, but no, I brought a textbook, Kendall's Muscle Testing and Function, because we went through all of the manual muscle tests and all the specific muscle tests. But there was this section on posture that was a part of the book that we never even touched. So I was like, well, I'll read that and study.
Oh my gosh, I didn't
So,
know that.
I didn't touch it the whole trip, except when we came back. My aunt, who worked for United, she got us hooked up with first class tickets on the way back, basically what was available. And so, you have the courses come through and, you get your socks and slippers and all that fun stuff and just, enjoying everything that they're throwing at you. So you go through everything and then they ask you if you want coffee. And I'm not a coffee drinker, but it just smelled so good. So I'm like, yeah, bring it on. And so I took the coffee, getting ready for, whatever it was, like 16-hour flight. And so everyone's going through like the movie and that, and they turn down the lights and I'm just like wide-eyed, tapping my foot, like stuck in the seat, wired on caffeine. So break open the book and I like just digested it. So I was on this flight and nothing else to do. So I'm just like reading it. So after graduating my undergrad, went to graduate school, became sort of disenfranchised with what was being taught and everything, because nothing was what I had learned in that part of that book. Nothing was really looking at posture and structure. Everyone was going symptom and, symptom remediation and meds and bracing and that kind of stuff. So it was like, where's that? And so it was kind of like just floating along and going through different site tours, while I was in grad school and just like nothing really fit. There was some cool science out, different machines and different ways of coming at chronic pain or different people with injuries and stuff. But again, it was nothing there. And it was just a fluke that a friend of mine told me that they were hiring at Egoscue. I didn't even know how to spell it. I went to their old location. I had no idea where I was going. But once I got it and found out about, the actual thing, I interviewed, I read the book, and it was just like in the 90s, I guess the specific thing would be, getting addicted to something like crack. It was just like, it was everything that was in that book, but then like applied, in reality, like, oh, this is connected to this and this is connected to this. So these things actually, take on a different form. And it's not a brace that's going to fix it. It's not a pill that's going to fix it. It's not an injection. It's not a surgery necessarily. And so, let's come at it from like the body is capable and we can remind it how it's supposed to work, or this is your inherent nature or your inherent design. So we can tap back into that. It was really cool to actually like come full circle on something that had planted seeds, 3 years prior. Mm-hmm. And then to go like, this is the only place that this is actually happening. Mm-hmm. And it's here in San Diego, which, of all places that I happen to live in. So it really was a cool thing. So, but yeah, thanks for sharing that. It's always interesting, like different backgrounds, and people always ask, like, oh, how did you get involved? So I'm sure they'll be happy to hear the different stories as well.